Hi, my name is David Love. I'm an orthopedic spine surgeon here at Georgia Bone and Joint in Newnan, Georgia. And I'm here to answer some questions from viewers on our social media. I send almost all my patients to physical therapy formally because there's more robust evidence to support its use in the care for back pain and sciatica. However, I never discourage patients from seeking alternative treatments and chiropractic care because although it may not work for everyone, if it works for you, that's completely fine with me. So the answer to this is slightly nuanced. It's a good question. An acute trauma or a significant stress on the disc itself can cause the contents to herniate outward, which I think is what most people are thinking of when they think about a herniated disc, an acute event. One of the analogies we often use is kind of like a jelly donut releasing the inner contents. But by far the most common issue I see is a bulging disc or a sort of a degenerative herniation. So over time the disc loses height and water content and sort of bulges outwards, and if that gets to a critical point, it can cause nerve pain, which is something we see commonly. Back pain is a very broad concept, so it's the second most reason for presentation to the doctor outside of cold or an upper respiratory infection, and most adults during their lifetimes will have an episode or episodes of back pain. Common injuries are overuse and muscle injury and muscle strain, and that's probably the most common thing that we see. And one of the most common causes on top of that is degenerative arthritis. Everyone's back and discs degenerate over time at some rate. Certain things can precipitate that. A lot of it's genetic. But the joints of the spine are extremely complex, so there's a disc at every single level. So just like you have two knees that may become arthritic, you can have 33 different spinal segments that develop some form of arthritis. So any small issue with one of those joints or discs can cause back pain. As common as it is, the cause is not often specifically determinable. So just like you may present to your doctor to discuss high blood pressure or high cholesterol, they may not have an exact reason for why you developed that, as opposed to not having it the year before. But importantly, we know how to treat it so we can make the vast majority of patients better. Just like any intervention in medicine, spine surgery is very successful when it's performed for the right patient and the right indications. In terms of overall success, it's very nuanced in terms of different procedures, be they small, minimally invasive procedures versus large deformity corrections. Obviously, there's a different risk profile for each of those, but in terms of indicated spine surgery, it ranks among the most successful procedures in all of medicine, especially when it's performed for the right reasons. So the simplest way to put it is compression fractures are caused by axial load, so compression force on a vertebrae that exceeds the ability for that vertebrae, the bones of the spine, to resist that force. Most of the time, they're caused by osteoporosis, and they are actually by far the most common form of osteoporotic compression fracture, more so than hip fractures and wrist fractures combined, actually. So that's why it's very important, and I see this often for elderly patients, especially women, to talk to their primary doctors about screening for osteoporosis to prevent this from happening. So the primary goal of the vast majority of spine procedures is to relieve pressure on compressed nerves that's causing nerve pain. It's also commonly performed for compression of the spinal cord in certain patients, as well as for deformity correction and things like scoliosis that you may have heard of. So I very rarely recommend surgery as the first option during our first visit with the patient, with the exception of certain cases like acute trauma causing instability or neurologic issues that are irreversible, which are quite rare, but they do happen. A certain subset of people with spinal cord compression causing downstream symptoms of gait balance issues, dexterity issues, things like that is called myelopathy. And those patients do also benefit from early surgical intervention as well. The fact is the vast majority of patients respond well to conservative treatment. including medication, physical therapy, with the occasional addition of targeted injections. For those patients that fail those conservative modalities over an appropriate time course, with pathology that's concordant with their symptoms on MRI, those patients are good candidates for surgery. The fact is the vast majority of patients respond well to conservative treatment, including physical therapy, certain medications, and occasionally targeted injections like epidurals. For those patients that fail that course, meaning their symptoms don't improve or persist to a point where they're limited and they don't feel like they're able to function appropriately, then those patients are excellent candidates for surgery, provided they have appropriate risk factors. In general, there's no way to correct the structural spinal deformity with either external manipulation, physical therapy, or anything outside of surgery. But if the curvature or humpback, as you're describing, is flexible, then yes, I think that exercise and postural re-education, often done with the guidance of a physical therapist, can help sort of create a better posture. Absolutely. Strengthening your back and core and engaging in flexibility work at home can greatly reduce the risk of back pain and improve back pain flares when you do have them. There are a lot of resources available on the internet for this. Most are pretty robust. There is one from the AAOS, the American Academy of Orthopedic Surgeons, that actually has a 3 or 4 page outline of exercises you can do for neck and back strengthening. Yoga and Pilates are excellent forms of exercise for back pain specifically, and I always recommend lifestyle modification for people that have certain risk factors. A couple things that are important to note: smoking and tobacco use have both been shown to potentiate disc degeneration, meaning they make what's already sort of going on at a background rate in everybody worse faster. So I always highly recommend that you stop smoking, as I'm sure most doctors have told you, those of you that do smoke. Obesity can also play a large role. It's a difficult conversation for most doctors to have with their patients, but there's robust literature that shows that losing even a small percentage of someone's body weight and getting down to a normal BMI can completely resolve most back pain symptoms. And in the end, they make intervention, if we had to go that route, much safer to perform. This is a little bit of a loaded question. I don't want to anger the avid CrossFitters out there. I would say that no one exercise is intrinsically bad for your back. There's actually a small study out there that shows deadlifts improve back pain in a cohort of patients, but these people were followed by personal trainers, and every single rep was monitored very closely to account for perfect form. When someone lifts too heavy or with improper form, deadlifts are a very common reason we see people sort of injure a muscle in their back. But at appropriate weight and appropriate with good form, deadlifts are a perfectly safe exercise. So we got a few questions about personal surgical stories and individual cases that are difficult to answer without getting into too much specifics about your case and not having all the information available. But I'm happy to see any of you guys that reached out with these questions in clinic and to discuss options. There was one that mentioned, is there any hope for me? I would say there's never no hope for a patient. So there's always something we can add or recommend that can potentially help you feel better.